Work Wellness Institute is transforming research into workplace performance and health. As an organization, we function throughout the complete cycle of turning research into practice, mobilizing knowledge as a research institute, community partner, funder, and educational provider. Our mission of creating safe, healthy, and inclusive workplaces for all is our driving motivation. Learning is a lifelong journey to adapt to the forever changing needs of the workplace. Whether you are a leader, a professional, an academic, or a student, we provide high-quality resources that are evidence-based, topical, and relevant to all industries. Choose the Work Wellness Institute as your learning journey partner and become a member to gain full access to our diverse knowledge mobilization programming, including lectures on demand, e-curriculum, 3 distinct certification opportunities, and more. Continue to learn and connect with the Work Wellness Institute and see how we can support transforming research into performance and health for your workplace.
Once again, welcome to everyone. Good morning, afternoon, evening, depending on where you're joining. We're so thrilled to have you here. I would like to start out by thanking you for joining us in today's webinar on occupational stress and burnout in healthcare providers, challenges and solutions to improve quality of care and service delivery. My name is Elizabeth White, and I am the team lead of Learning and Development with the Work Wellness Institute, and I'll be helping to host and moderate today's session. I would also like to begin by acknowledging that I have the privilege to live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Tsleil-Waututh, Musqueam, and Squamish nations. This webinar is made possible through the support of our funders, partners, as well as memberships to the Work Wellness Institute. And we also like to thank our advisory committee and, of course, our speakers who contribute to this webinar series. Thank you so much for indulging me in those few moments of housekeeping. And I'm very pleased to move into the kind of main event for today. And we're excited to have Dr. Badin Norazikia with us today. Who is an occupational therapist and assistant professor in the Department of Occupational Science and Occupational Therapy, where he holds the Emily Geldsaler Grant Early Career Professorship in Workplace Mental Health. His research program is a systematic study of occupations in the areas of work disability prevention, return to work, and disability management. This approach is designed to produce results directly applicable to identify and assess risk and to develop interventions for preventing and improving and optimizing functioning in the workplace. His work uses a biopsychosocial perspective to understand work disability and incorporate personal characteristics and environmental factors to improving health outcomes. So thank you so much for being here today, and I'm happy to pass things over to you.
Thank you very much for that kind introduction, Elizabeth, and thanks everyone. Thank you for having me. I'm delighted to be here with you. And what I thought I would do is spend the next little bit of time that I have with you to talk to you a little bit about these mental health outcomes, and with a particular focus on the healthcare sector. Hopefully, my understanding is that we have people interested from this sector, but of course, there could be others that may want to apply it to their workplace, may want to apply some of this work to policy as well. And I am going to be a little bit of a bias because I am obviously based in Toronto, Ontario, for those of you that are across Canada. So a lot of my examples are from Ontario, but I think what I've provided and will provide to you in terms of solutions will be applicable not only across the country, but I think globally as well. So you heard a little bit about me. I also wanted to take this opportunity to tell you a little bit about my team. So, I have the privilege to be here with you today to talk about the work that we do, but I'm certainly not alone. So the mission of the lab that I lead, the Rehabilitation Sciences through Occupational Research and Engagement, is exactly this, is to understand workplace issues, to understand them through a risk behavior perspective. But because I'm an occupational therapist, is that we oftentimes, and I look at it through a functional lens. That is, how does this impact someone's actual work and what they do in the workplace. So work performance, optimizing functioning is paramount to me from a research perspective, but also for the clinicians in the room. We know that that's also a very important clinical outcome, right? So we know that when we have clients or patients coming to us, they may exhibit tremendous amount of signs and symptoms, but it's not impacting their work. On the obverse, we have those that exhibit very few symptoms or any few signs, and it's debilitating for them to return to work or stay at work. So for me, the happy medium is to understand how this impacts functioning. And I think as occupational therapy, that is really our unique contribution in our lens. So if there's one take-home message that I would have for you today is to understand where occupational therapy comes into this as opposed to other health professions and what we would like to be interested in, which is really to assess and treat issues that impact functioning at work. In this case, looking at specifically burnout and job stress. So a little bit more about my team. So I'm one of many. I have graduate learners, I have postdoctoral learners, undergraduate trainees, clinical learners that I'm really a privilege to be working with, and other collaborating scientists that are part of the University of Toronto's network or the teaching hospitals that are affiliated with the University of Toronto's Temerity Faculty of Medicine, and that's where I'm housed. So I'm an occupational therapist. I have a private practice that I'm still involved with, but my main appointment is in the University of Toronto. I'm in the Faculty of Medicine in the Department of Occupational Science, and there I'm involved with research looking at workplace mental health. In particular, certain sectors that I'm very interested in is one of them is the healthcare space. And we know that since this pandemic has started, the COVID-19 pandemic, and yes, to some people, maybe it's over, to me, it's not, it's still ongoing, is that we're seeing that some of these health issues, particularly the mental health side, are exacerbated. And we're going to talk a little bit more about that. So my agenda for you, and I think I have a bit of a daunting task for the next 30 some odd minutes, is to talk a little bit about the impact of work and health. We have to have some understanding of why health and work are intimately tied to one another. You may already know this, maybe you don't. And then talk a little bit more about some of the challenges that we're facing in the workplace when it comes to workplace mental health in the healthcare sector. And then I promise that I'll also talk a little bit about solutions and strategies. And these solutions and strategies will focus at the individual level. You could also see them focusing at the organizational level, but also on the broader policy perspective. So there are opportunities for all of us to work together. We're part of the same systems collective. So we want to improve our healthcare system wherever we are situated, whether it's across Canada or globally, and improve the care that patients receive. And those patients or clients are going to be ourselves as well. So we have a vested interest, if not for ourselves, to wanting to get the best care that we want when we go and interact with the healthcare system. So I want to kind of describe, or these are my learning objectives for those of you that are keeping track, is we want to talk a little bit about what occupational stress is, what burnout is, what are the components of a burnout. We'll talk about some of the risk factors that the literature indicates are associated with burnout, and how does this impact the delivery of care. You may have seen it in your jurisdiction where you are, about how burnout is keeping people away from the healthcare system as providers, right? People don't want to go into these environments and continuously work when they're going to be exposed to very dangerous occupational hazards. And why would you? It doesn't make sense to do that. So they leave. And that's a significant consideration. I'll also talk about some of the strategies, and some of the strategies that we'll have will look at individual level. So what can we do to support the individual? But I will not only stop there. I think this is a shared responsibility with workplaces and policymakers and governments, that we have to work collectively together in providing these solutions. So these are the three things that I'll cover in the next 30 minutes or so. So I'll start off by, talking about the seminal textbook that, for those of you that are not into theory, I apologize. I have to get this slide in because I think it's very important for us to have a solid understanding of where I'm coming from. So there's this very important textbook that talks about the relationship between work and health. And essentially what it says in a nutshell is that work can be therapeutic, and the obverse is true as well. It can also be deleterious. So as somebody who comes from occupational therapy, we're very interested in looking at how we believe that human beings are innately going to engage in activities, or what we call occupations. Those activities are going to be some that are at paid work, the areas that I explore, but it could be outside of paid of work as well, so paid work. So we know that engaging in these activities is going to lead to better health outcomes. There's a large body of literature that says us working is good for our health. But we also know that there's too much of a good thing as well. If we are overworked, that could lead to poor health outcomes. And we'll talk about some of those. Sometimes the opposite issue, if we're underworked, that could also lead to poor health outcomes. But just keep this in mind that work is good for our health, but too much or too little of it can also be deleterious for our health. And that's important for us to keep in mind. So when we talk about the importance of good health, when we're talking about healthcare workers and the impact that they have because of burnout, well, a lot of things can happen, right? Someone may not want to come into the workplace, and we know that these individuals, in terms of their training, if you think of a registered nurse, you think of a doctor, an occupational therapist, or anybody else, it takes a lot of years to train them, to get them to the point where they're going to interact with the healthcare system, and then only to have them want to leave. And that's exactly what's happening across the globe. We're seeing a lot of people leaving the system, and the replacements are not coming because it takes time to do that. And the other issue that's happening is that a lot of these individuals are experienced. They have a lot of experience in the workplace, and we're losing that as well. That's not something that's unusual just to the healthcare sector, but it's something that we're desperately needing to address. And these are not issues that were just started because of the pandemic. This was long before the pandemic. Issues with burnout and occupational stress were happening. I kind of say sometimes when I give these types of talks to audiences like this, I was studying burnout before it was cool, and looking at burnout in terms of, how does it impact what somebody's doing in the workplace. So we want to study that and look at it carefully. So you may have seen things like this in the workplace, right? You may have seen some of these headlines in the popular press. Around how physicians are tired, nurses are tired, people are burnt out, and all of the issues that come with that. Well, that's going to have some significant issues in the delivery of care. You may be in a healthcare system right now and on this call trying to see, what are some of the strategies that I can use to improve the health system that I'm a part of, and hopefully I can provide you with some key findings and strategies and solutions that you can move forward. And I'm happy to talk to anybody about their particular circumstances and give you some examples of some of the work that we've done as well with different health systems. So a little bit about some of the concepts of job stress or occupational burnout, really looking at essentially a situation where the job demands are overwhelming and exceeding the individual's ability to do them. So once you have this imbalance, this is what happens: is the individual can't cope, and this may lead to physical or emotional challenges. So coming through it from a biopsychosocial side, and yes, this is a mental health talk exclusive predominantly, but this, I'd be remiss if I didn't tell you this also has significant health challenges on the physical side. There's lots of bodies of literature that looks at the cardiovascular issues that come with stress and burnout and depression and so forth, and chronic diseases, diabetes, kidney disease, and so forth. I won't spend too much time on that, only to tell you that the entire body is intimately linked, and the body-mind connection is one that we should always be keeping in mind, both as healthcare providers, but also as individuals, knowing that we're more than just the sum of our parts. We provide a much more broader perspective that we can understand through a biopsychosocial lens. And a biopsychosocial lens is precisely what it is. I didn't have time to kind of go too much into it, but it really recognizes that we have a biological aspect, we have a mental health aspect, and we have an environmental aspect. And the confluence of the three is really where we are situated. And trying to find the right balance between all of them is exactly what I try to do with some of the research that I'll be presenting to you today. Similarly, from burnout. Burnout can be as a result of those outcomes that are on the screen: emotional exhaustion, cynicism, reduced professional efficacy. The ICD, the International Classification for Disease, version 11 that came out, really looked at not necessarily identifying burnout as a medical diagnosis, but rather as a syndrome. So basically, a collective of signs and symptoms that go together and typically are exhibited together. And you see this in burnout. And the other aspect that they identify is that it's an occupational phenomenon. So it's got its underpinnings in work. So we have to be able to understand that relationship and recognize that because it is an occupational phenomenon, there's a shared responsibility between the individual and the workplace, and also governments. And I think that's very, very important to understand that relationship. So for those of you that live and breathe this, and I'm sure there are many, that last year, in May of 2022, the U.S. Surgeon General released an unprecedented report. And I'll say it's unprecedented because he made healthcare burnout a top priority to the United States Department of Health and Human Services. So that's unheard of when it looks at constructs around workplace mental health. So they essentially identified that there's a large body of literature, and also what they were collecting data, and also what they were providing in their report. And the report is free of charge. You can look at it. I have the link in my presentation. You can download it, or you can look it up right now. If you put U.S. Surgeon General report, you'll get it. And it talks about essentially how doctors, nurses, other healthcare professionals, interprofessional healthcare workers, allied health members are all experiencing high levels of burnout. And this is significant because this is impacting the way our healthcare system is delivering care. So if you care for no other reason other than to provide patient care, client care, this is why you would want it to care. On the other side, it's also because we have to understand that there's a recruitment and retention aspect. Workers in this sector may want to leave and not engage or work at all in the healthcare sector. So that leaves us with a significant shortage of health human resources. So the other aspects that they talk about burnout, and I've alluded to earlier, but I think it's really important, is to understand that this is really a complex continuum. So if you look at the screen, there's the individual aspects of it, there's the organizational, there's the health system, but then there are societal and cultural considerations. And if you only address one or the other, you're not looking at burnout in its entirety. And if you looked at studies on burnout from maybe 20 years ago, you would see studies that oftentimes worked on the individual, right? So what's the individual's level of resilience? What are they able to do to address burnout? But now we know that that's not sufficient. And for those of you that are in the research space, you know that we have to look at this through a complementary approach, a shared responsibility approach. And I'll talk about some of those solutions as to why I think that's important, where the worker, the employer, the organization, the healthcare system itself, and the governments or broader society have to all be working together, because these are complicated, multifaceted issues that we're dealing about, just along with burnout. Similarly, on the impacts of burnout are quite significant. I've really stressed in this talk around the healthcare system, but it's also patients. And you may see this, for those of you that are in Canada, you may see stories in the media around how somebody would go to the emergency room and not be seen by a healthcare provider for hours. And God forbid, sometimes those people perish, unfortunately. We don't want those types of situations to occur. And of course, we have to understand that burnout plays a part in that. And we have to understand it more comprehensively, more holistically, and provide solutions that are meaningful and appropriate within the settings where these types of situations are occurring. So, having said that, I think the other aspect that we have to understand is that just like burnout is complex, job stress is complex, so is return to work. The literature undoubtedly has identified more than 100 factors that predict or influence return to work. And for those of you, that are wearing a clinical hat, you may also have your clients come to you and say, am I ready for return to work? Am I ready to go back? I'm worried that, I'm going to experience burnout again, or job stress again. Or, for those that are concerned about what happens if I'm not successful and I go back, is it a failure to me? So all of these are entirely normal and within reason for us to be able to be cognizant of, both as researchers, as providers, as policymakers, as human resources professionals, as disability management professionals as well. So I think all of us play an important collective in addressing some of these questions. We similarly know that there's different outcomes that are shown through the evidence, and what I'm providing to you today is evidence-based outcomes and solutions around supporting return to work. So if you think of somebody who's experiencing burnout, you also want to look at what are the issues, what are the factors that will ameliorate their health outcome. One of the strong predictors of that is early and timely return to work. And I'll just move to this slide, and this is from epidemiological data that's been around now for many decades, decades, and it looks at the relationship between going back to work and time off work. And the earlier you can bring someone back, if you can take away one message for my talk today, is this inverse relationship. So early interventions is appropriate. Ideally, if you can get to somebody within the first 3 months or 12 weeks, that's ideal. But I recognize, in a system where there's complexity and you're dealing with a workers' compensation board that also sits one foot in the healthcare system and one outside of it, is that it creates a lot of complexity in terms of referral times and people getting the services that they need. But the data is quite clear. We've known this for decades, and this relationship is exactly what we're fighting against, which is time. So if somebody goes off work, we want to make sure that we bring them back to work as soon as possible. The other aspect of it that I'll provide is just that there are also some resources around successful return to work management. And the Institute for Work and Health in Toronto has these 7 principles. I'll let you read them, but really what they boil down to is essentially providing support, having coordination involved in the return to work care, having people involved in that care outside of not only the disability manager or the healthcare provider, but having a collective approach. Early timing and return to work is appropriate. Also identifying who's going to be in charge of that return to work coordination and having the appropriate channels for communication. I can't think of how many times where the worker may want to go back, but then they're not sure if the employer is going to be supportive, and those channels are broken down. And we all can play a role in supporting that return to work coordination. Similarly, just to give you an example of some of the work that we've done with different healthcare groups, and I've deliberately picked these examples not to think of just the ones that we see in the popular press, rather than, for example, if you remember the earlier parts of the pandemic when we were all out banging our pots and pans and cheering our doctors and nurses, and appropriately so. We need them. We need all of the other team members that are in those settings, but there's also other team members that may not have been as visible. And some of the ones that I'm presenting today are those that may not have been visible. So we did some of the work here in Ontario with the Medical Laboratory Professionals Association, which is an association that represents medical laboratory technologists. And we looked at some of their burnout issues. And in fact, compared to what's in the literature, compared to some of the other groups like occupational therapists, like physical therapists, psychologists, and others, they experience extremely high rates of burnout. And you might think, why might that be? Someone who is typically not patient facing or client facing, they work in the background, they do all the testing for COVID-19. And here in Ontario, for example, at the height of the second and third waves, we were really experiencing people wanting their test results right away. And these workers were overworked, overstressed. They wanted to do the best they could with what the resources they had available to them. And many of them, unfortunately, crumbled under that pressure. And we looked at some of that with the medical laboratory technologies, and they exceeded really high burnout rate. In our study, we reported 72% burnout rate, and so it's unheard of to be that high. It's higher than any of the other groups that I've mentioned today. And also what we did was essentially we did a survey with them. We also did some focus groups, and we looked at some of the factors that were associated with burnout in this population. So I just wanted to give you one example of the groups that we've worked with and how the early parts, the acute phase of the pandemic has really impacted the care that we provide. And they also provide a lot of the care, for example, around cancer screening and understanding, if the results for cancer tests come out, they're usually the first ones to see it, even before the medical practitioner is able to communicate that result to you and, for example, provide a diagnosis. So they do play a significant role in our healthcare system, but we don't know very much about them. So our team is exploring that further. We've also done lots of these studies with more of the quote unquote mainstream healthcare professionals like doctors, nurses, rehab professionals, and so forth. So here's a bit of that summary. We essentially found that lower job satisfaction was associated with higher burnout rates. And this is fairly consistent in other healthcare groups, just to give you an example. And we also found that generally if they had higher job demands and so forth, they had experienced higher burnout rates. So it's nice to establish that relationship to reinforce what the literature is saying and so forth. And also job insecurity was associated with burnout as well. And that speaks volumes, right? So the idea of contract work, temporary work, people only there part-time, that's only going to make the situation worse. Similarly, we also looked at doing some work around, our team did, looking at a systematic review. So basically, a very detailed review of the existing evidence in the literature, in the scientific literature that's peer reviewed around the topic of burnout and working during pandemics. And essentially, what we found were 9 factors that were associated with work performance. And we looked at the ability for healthcare providers across the spectrum. So we looked at doctors, nurses, and so forth. Um, and we found these 9 factors. And one of them was around burnout and fatigue. There were many others that we explored, and we also looked at the relationship mathematically as well. But qualitatively, I can tell you that these 9 factors are extremely important for us to address, not only from the perspective of the individual, but also at the organizational level. So, what is it that we can do in the workplace to ensure that stress levels are low? And we'll talk a little bit more about that and so forth. So, and this paper is freely available, and the citations are in my reference list that you'll have access to as well. So I did promise that we also looked at some of the larger health professions that are regulated. We looked at intent to leave in nurses here in Ontario and acute care hospitals. And succinctly, I can tell you that essentially greater job satisfaction, greater control over their work, greater flexibility in having those interprofessional relationships and resource availability were all strong predictors of keeping people in the workplace. That should hopefully be not a surprise to too many of you, but it's important to state these because these are exactly the types of evidence and information that we need to go to policymakers as researchers and to say to them, this is what the evidence is directing us to. Please support, the healthcare workers in this regard, because this is what we're finding out. And this is consistent in the literature and what we're seeing in our own findings with our research teams as well. So I promise that I'd provide you with some evidence and some solutions as to what can be done. And I think I'll start off with some higher level solutions and then maybe work my way down to individual level solutions. So I think 2 important resources that organizations in particular and even the healthcare sector can look at is looking at some of the standards that have come out from the CSA group in Canada. So this is a national standard association in Canada, and essentially standards, the CSA group works across many different areas, including the occupational health and safety sector, to bring together essentially guidelines and approaches that can be used to ameliorate our workplace, particularly around workplace mental health. And the 2 standard screenshots that I've provided here to you, really speak to that. So the Z1003 really was developed in 2013. It's gone through 1 renewal, and it's actually going through a 2nd renewal now. So every 5 years, the standards are updated to make sure they're current. And it really put Canada at the vanguard of workplace mental health because it was the first standard of its kind, the first guideline, essentially, if I can say, that really looked at understanding workplace mental health and identifying what should be done in terms of from the perspective of improving workplace mental health and the shared responsibility that comes with that. The 2nd standard that I think will be also appropriate, and it goes beyond just the mental health aspect, is looking at work disability management systems. So looking at how do we support return to work? How do we support somebody who may be experiencing burnout in a particular organization? Maybe it's not necessarily a hospital setting. Maybe it's a community center or a clinic. Both of these standards can be applicable to any type of organization level, small or large, and it's deliberately done that way so that solutions can be targeted and implemented across organizations, and there could be uniform comparisons across those organizations. So the way that you would think of in the manufacturing sector or any of those where they take standards and allow them to compare one another in an organization or across organizations rather, you can do that in the healthcare system. And these occupational health and safety standards are no different to that. So essentially, in a nutshell, what we're looking at is providing guidance for developing health and safety from the Z1003 standard. Similarly, healthcare professionals are recognized for their expertise. Similarly, in the 1011 standard to the right of that, we recognize that healthcare professionals have a role to play. We have an important role, but we're certainly not the only roles. And I think based on the audience today, we know that human resources professionals, colleagues are there for us to liaise around the workplace considerations. Our work disability management professionals are also there to play a key role. And all of us have a shared responsibility in this area. I wanted to emphasize really Annex B of the CSA 1011 standard as a very direct way for us to use this guideline to address workplace issues and work incongruity in an organization that you will be involved in. So if you're looking at burnout, it looks at specifically what the healthcare sector can do, what the healthcare professional's role is, and how do you liaise with that. There's lots of other annexes and other supplements to these guidelines that talk about, for example, the role of human resources professionals, the role of others that are involved in this. I just don't have enough time to go through all of it, but I just wanted to highlight the healthcare role just because we're talking about the healthcare sector and recognize that this has come from experts that have come together, discussed it, and so forth. Similarly, with the CSA 10 1003, Z 1003, you're looking at 13 domains. And these domains are essentially areas where it's been identified through a review of the evidence and consensus-based discussion with the standard committee around what would be important to improve or facilitate a healthy workplace. So essentially, in a nutshell, how do we mitigate against burnout and job stress? Well, it's to understand that there are these 13 domains and to assess and measure them. So at a policy level, at a hierarchical organizational level, these are the kinds of benchmarks that you may want to consider implementing into your hospital or your community center or if, in your clinic, and then finding ways to measure that. Obviously the needs are going to be different if you're in a large teaching hospital, maybe in Vancouver, than you are in a small clinic in Northern Ontario. But nonetheless, the concepts and the ideas are the same. You may just need different levels of support to get you there. So moving one step down to the individual level, I think what would be really interesting is also for us to kind of look at how does this impact the person? So how does this impact the worker in the healthcare sector who experiences burnout? And there are tools such as the Guarding Minds, which take the 13 domains from the psychological safety and well-being in the workplace standard, the Z 1003, and then have a series of questions or a battery where someone can complete it. It's entirely free to complete the questionnaire, and then to come up with a composition of, what are the opportunities for maybe potential intervention in the workplace. So hopefully, at a very high level, we have opportunities to address policy. We also have opportunity to work with the individuals as well. So, my concluding remarks are rather short, but I think it captures a lot of information that I've hopefully tried to convey to you in a meaningful way here today. And one of the ones is that, we need urgent attention. This has been going on for many years, and we need attention both from policymakers, governments, healthcare organizations, but also the individual workers, all of us working together to address these challenges. These are multi-sectorial, multifactorial, complex, and it's not going to be good enough to just address one level. There has to be a concerted effort. And, funding is always going to be an issue when healthcare organizations come to the table. But if we're going to make some meaningful changes, if we're going to meaningfully address these mental health issues in the workplace, such as burnout and job stress, we have to be able to have honest discussions that are based on evidence, and then come together and find where we can move forward together. Similarly, looking at implementations of solutions and strategies, look at some of the literature that's been written, both in the peer review and also some of the reports. So I talked about the Surgeon General reports. At the end of that document, there's a list of recommendations that they provide, very similar to what I'm providing you today, which is around working together, understanding the nuances of burnout, recognizing that it's complex, and a biopsychosocial approach is needed. Similarly, the WHO, which I didn't mention, also came out with a report on workplace mental health in September of 2022. So just over a year ago now, and it's quite comprehensive, over 140 pages. And in it, they get into details around the importance of workplace mental health, the importance of addressing these issues, not only in high income countries like where I am in Canada, but also in middle and low income countries as well. So if this is something that, unfortunately, this is not something that just touches us here in wealthier nations financially, but also in other countries as well. So there's a lot of work to do. Hopefully that I've convinced you that we can work together on this, and I'd be happy to take any questions that you have. My contact information is there if you want to reach out to me about a potential challenge that you have in your workplace and you think that working with a researcher may be able to address that. I'd be happy to do that. We've done that kind of partnership with other stakeholders, both in community level and hospital settings, and we're delighted to learn more about the work and what you're doing as well. So hopefully we can have a two-way discussion, even though you know I'm here talking to you. So thanks very much. That's it for me. I'm happy to take questions.
Thank you so much for that presentation. I can see that questions are already streaming in, but I'll just take one moment to remind all that you can send your questions through the either Q&A function in your toolbar or the chat function through the toolbar. So whichever feels more comfortable to you. And also just note that I did drop your email into the chat so people have a little longer
Perfect.
to write that down should they need. And thank you for your willingness to connect past this webinar. Okay, I will dive into our first question here. So we seem to be in a vicious cycle, which I think you addressed a little bit as well. Staffing shortages lead to workplace stress for the remaining staff, which then leads them to experience burnout and maybe decision to leave.
Yeah.
Staff are calling in sick, claiming mental health days, which contributes to the short. So this cycle, all of that, and just perpetuates the problem. So are you able to kind of address that and any maybe solutions that are specific to this cycle that we continuously see?
Yeah, absolutely. I mean, thanks for the question. And yes, that's what we're seeing. If we don't do anything about it, this is what's going to end up happening, and it's going to get worse and worse. And that's exactly what's happening because we need to be addressing workplace mental health outcomes like burnout and job stress through a concerted effort. So it's so much that I can talk to you about the evidence, but we also have to make meaningful change, and that meaningful change has to come both at the organizational level. So our leaders, those that are in systems where they make decisions and are decision makers, have to be committed. And I think many of them are. But we also, the nature of how healthcare is delivered in Canada, we know that it's provincially funded, federally supported. We need all of these stakeholders involved, and they have to recognize and value that burnout and workplace outcomes like this are going to impact their bottom line as well. So, I can be quite blunt in saying that. It's not just in the healthcare system. I didn't talk about some of the work that we're doing in community care, but they're unfortunately even far worse than how resource-rich hospitals, I'll call it, because of the fact that they even get less attention. Nobody knows about the challenges they had. So, for, some of the work that we've done within community cares with rehabilitation professionals looked at how they didn't even have PPE at the beginning of the pandemic because they were all being allocated in Ontario to the healthcare system and acute care hospitals, and they were going to see their clients, and they had no personal protection to the equipment to address. So all of us have to work together. It's not going to be overnight, but I've been, working with policymakers here in the province of Ontario, both in the Ministry of Labor and Health, which are very vested and interested in these topics, and to make sure that they always keep this top of mind. And I think they do, but I think we also want to get the voices of those healthcare groups that aren't necessarily always in the limelight, like the doctors and nurses. We love them, I love them, we need them, but there's a lot more to the healthcare system than that. Hopefully
Thank
that
you so
helped
much.
in answering your question.
Yeah, of course. And if there's anything follow up, please, again, to the audience, you can continue to ask questions and we'll get to them as much as we can. But thank you for that. I think just personally, that was something I really took away from this presentation is opening that scope of not just those frontline workers, those immediate healthcare
Yeah,
providers that we think of and all of the layers that come with that.
absolutely.
So going to the next person here. So an excellent overview. So thank you for that. Thank you so much, audience, for providing that feedback. But just wondering how you measure satisfaction levels related to burnout. So maybe those that have received great care and
Yeah.
support through the burnout, or just kind of, yeah, that satisfaction levels of how burnout's being addressed.
Sure. I mean, specific, we can definitely measure it quantitatively. There are measures or there's tools out there, questionnaires that we can ask that are validated that look at burnout outcomes. There's like the Copenhagen Burnout Inventory, the Maslach Burnout Inventory. These are all going to be constructs that are captured there. There's other tools as well that you can look at. The COPSOC 3 that looks at workplace psychosocial workplace environments, and that will include both burnout and job satisfaction from a quantitative perspective. But I think we're also valuing that we can also talk to people. The lived experience is extremely important. So talking to the healthcare providers, what is it like for them to be in these environments? And when you do this in a research perspective, some of the focus groups that we have been very cathartic. People have come there in tears because they're talking about how difficult this has been for them to be able to, you're a caring person when you go into healthcare. It's just a part of, I think, the types of people that are interested in these roles. And when they aren't able to provide their best all the time, that really hits them in their core. And you see that with you see that more in the qualitative language. And I didn't get a chance to present some of that work today, but if you're interested, I'm happy to share it with you, or you can look at some of our work around that, because I think it's a complement of both. I think the quantitative might be more satisfying to those that are more interested into the numbers, but I think we also value the lived experience that comes with it. And more funders on the research side want to see that not included just as an afterthought, but actually part of the co-design of the work that we do.
Oh, that's really good to hear, I think, because I do think it's an important balance to have, yes, the numbers, we love to all have that kind of coming into the meeting or whatever we want, but
Absolutely.
I absolutely think the lived experience, the conversations, the stories, just amplify the need and the
Well
urgency
said.
that you've talked to today.
Absolutely.
You actually hit on another question we received, so I'll go to that one. You mentioned kind of this, like the impact of not getting to do your best because of burnout or stress. So we have a question right around that, around moral distress, is kind of what they've
Yeah.
coined it as. So repeatedly seeing patients not receiving the care that the professionals feel that they should. So just looking to your opinion on this, and kind of how maybe that can be included in how we're discussing the burnout and the effects of it.
Absolutely. I wish I had more time, but that's definitely a topic for further discussion. So, like moral injury and moral distress are two key terms that have really become paramount and synonymous in the healthcare sector, because exactly what you just said in the comments. So, I couldn't agree with you more. I think this is very difficult for healthcare providers that know there's a need, and you keep getting exposed to that, and then there's how can I help, but your hands are tied from a system, and that's why a lot of the approaches that we're suggesting have to address the system and the healthcare sector in a whole, as in its entirety. So those people that are decision makers have to be vested and wanting to commit to this level of change, but it's going to take time. But yes, I have colleagues that are looking at moral injury, moral distress. It's a relatively newer concept, probably in the last 10, 15 years in the healthcare sector. But if you want to see measurement tools and more discussion, there's a lot more written probably for the last 30, 40 years from the US military that has looked at moral injury and moral injury in particular in the armed forces.
Okay, great. Thank you for kind of providing some more resources and different landscapes that this is being looked into. So you kind of mentioned this from the top that you've been looking at this kind of before it was cool, and one of our audience members also identifying that this is maybe not actually a new problem, perhaps more
No.
an amplified problem.
Yes.
And you've also talked about there's so many stakeholders kind of in the
Yes.
game right now. So from your perspective, or from the researcher or the research your colleagues are doing, who do you feel really needs to take the lead, and how do you get that kind of first person to really take the
Yeah.
charge and get that implementation of change to move that needle?
I think that's a great question. I think oftentimes policymakers, if you go to them, the governments who have the ability to provide additional financial funding into a system, they'll say, "Well, where's the evidence to show that?" And then organizations like the medical laboratory professionals will contact someone like me and say, let's look at what it's like to work in our landscape. Our members are saying, our workers are saying that, this is a very difficult space to work in, but we just don't have anything to substantiate it. So, I can play a role in providing the evidence, and then we can go to policymakers, to healthcare decision makers in organizations and show them the numbers. And then many times their ears perk up. They're like, oh, okay, so this is what's happening. How can we help? And you build on that momentum, and I think you can get there. It's a collective effort. I wouldn't say there's one person in particular. It depends on where you are. I think on the continuum, in my experience, if you've got the evidence and you've got the support from your colleagues in the workplace, then maybe this is an opportunity to go to government in the Canadian context and go to them and say, this is what we know. Please help us. This is where we are. We're in a serious situation. And I think that might be the best way to do it.
Yeah, absolutely. There is so many at play, and hopefully even conversations like today, being in situations here, maybe it is taking that back to the your employer or HR or whomever, and just try and get the conversation moving.
Absolutely.
Okay, fantastic. So moving into kind of talking to the staffing crisis again, but really focusing on this idea that, when it's short staffed, but you still have those that are willing to work, and those staff members are then going into the 70, 90 hours a week of work, which is
Yeah.
extreme, I would
Yeah.
personally say.
Yeah.
So how can we maybe put the onus on the employer or open up the conversation to the employer on regulating this or taking measures to limit, so we're not kind of getting into another cycle of burnout for those that are still here and willing to do the work?
Yeah, I think that's a great question. I think, it's to have these conversations continuously with them to show them what's been written about this from the scientific perspective. So you have hard evidence, so to quote unquote. And I just don't mean numbers. I mean people's experiences are equally important. And to bring this to them and say, this is what's happening in the healthcare system. Otherwise, we're just, we're basically burning these individuals wicks at both ends, like because they're basically we're taking people out, and the ones that are left have to work more. They have to work harder. And the other consideration that I will have for you, and this is something that I hear more and more, for example, here at the University of Toronto in the health professions, is that how do we support learners that are going into these environments? Are we setting them up for success, or are we setting them up for them to go into these quote unquote toxic work environments where they're going to be exposed to these occupational hazards, and they're going to want to run away and never come back? Like that's deplorable to me. So I think there's a lot of interest from different healthcare groups that want to make sure that learners are protected, but at the same time, workers are also protected. So I think we're all on the same page here for those of us on this discussion. And how do we do that? Increase visibility, dialogue, show them the work that we're doing, and I think that's how we move forward together. But do it as a collective. I'm part of a team, and I'm always happy to step aside and let somebody else who has their strengths move forward. And I think if we all have that type of mindset, I think we can go a lot further.
Yeah, absolutely. And again, hopefully, maybe attending something like this and opening that conversation can move that needle. And just kind of leading off of that from those that are, working that overtime, but really thinking about the contract workers. You touched on this a little
Yeah.
bit as well. There does seem to be a trend right now that it is hiring more of that contract work. So are you able to speak to, perhaps, is there research that's focusing on contractors? Is the experience different for someone that's a contractor versus a full-time employee? Just looking to get your thoughts around that difference in employment type.
Absolutely. I mean, yes, there is. Succinctly, essentially, those that are part-time or contract or basically not full-time, secure, permanent employment generally have poorer mental health outcomes. So one thing that I didn't talk about too much here is just theoretical mindset or lenses to look at. So something that we're very interested in our group is to look at it through an intersectional lens. So looking at what the individual's experiences and the different hats, so to speak, that they wear. So we didn't talk about gender here today, which that's very important. We didn't talk about sexual identity. We didn't talk about the experiences of new arrivals, older workers, younger workers. all of us wear multiple hats. So I think if you compound the transitional worker or the gig worker or those that are working in transitory, in addition to the other aspects of intersectional work and intersectional research, you're going to see that unfortunately they're going to experience even worse outcomes. And oftentimes these are people that are on the margins, on the periphery of a lot of these types of discussions. And sadly, they're not even included in a lot of this research. But that's something that I'd be happy to talk about. Gender and ethnicity as considerations, looking at it through a diversity, inclusion, and equity lens. That is very, very important to understand these constructs more intimately and more in depth.
Yes, and I certainly think that speaks to it's not kind of everyone is experiences the same experience, right? There's
Yeah,
certainly individualized nuance, and that intersectionality lens is so important to conversations here today, but conversations all across the workplace and experience of that. So kind of going into that more individualized experience. So someone that is experiencing burnout as an individual, can you provide some examples of kind of what the at the individual level, like what are some things that you can do? And I'll add maybe a section of how do you even self-identify that you are experiencing burnout, and then what are some steps you can take to support
yeah.
yourself?
Great question. Thanks for that. And sometimes, I'm guilty of it myself. So I'll be the first to disclose it, is that, you recognize the work that you're doing. Are you dedicating a lot of your time to work and nothing else? Take a deep breath, recognize and be aware. Self-awareness can go a long way. In terms of opportunities to kind of seek help, well, obviously there's the traditional ones that you can go to your health provider, to your employee assistance programs, if you have that available to your employer, as two channels. But I think really what we need to recognize is that, in the old days, burning out and working really hard and working extra was seen as a badge of honor. That's quite the opposite now. I would say that the thinking around it now is that you want to have a healthy work-life balance. You want to be able to spend time at work and do and give it everything you've got, but at the same time be able to turn it off, move out, and do something that is also meaningfully worthwhile to you, that's outside of work. And that's going to make sure that you don't burn out, that you succeed, you're optimizing your work functioning, but at the same time also giving you an opportunity to just decompress. And we see this all the time. Like I said, I'm sometimes guilty of it, and I try to be cognizant of that to make sure. But I think these are all the checks and balances that we can put in place, and also to have a workplace culture that values this as well is particularly important, because that's going to mean that your leaders and your managers and supervisors model this behavior. So, for example, if they're going to say, "I'm not going to answer my work emails on the weekend unless it's an emergency," obviously, and I would encourage you to do the same. Or don't send emails at Saturday at 7 a.m. just because your schedule works on that. Coordinate it so it's sent out on Monday, but you can write the email on Saturday. The technology is there. These are just some examples of how you at the individual level can improve your workplace and, mitigate burnout and job stress.
Yeah, thank you for that. I do feel, especially in this particular kind of work, and as you mentioned, it's so intrinsic, and the duty to help. I can only imagine that the putting yourself last is so easy to slip into, and yet so important to not do that.
Absolutely.
To
Yeah, well
you
said.
know, yeah, that whole kind of plain oxygen mask on yourself first
Exactly. Exactly.
thing. Yeah, absolutely. Just a little tie into that, from kind of a benefits perspective, an employer support perspective, is there anything that the research is showing is kind of more beneficial, or employees are really finding more supportive or helpful in this time than others? You may not be able to speak to it, but just throwing it out as a
Yeah,
potential there.
I can only say that that's something we're exploring with some of the
Hmm.
EAP providers globally. I don't have answers for you today, but I think that one area that we're looking at is EAP utilization, so employee assistance family, or EAP AFP utilization, and understanding why people use it and why they don't, and understanding the types of services that are available to them. So I think just that alone is poorly understood. We're trying to explore that further, but I don't have anything immediate off the top of my head to be able to answer that. But I think there's a little bit of literature on that. I was just reading about it a couple of weeks ago in Australia, where they looked at these idea of like who uses EAP services, for what do they use it, and what are the benefits to the with a focus in particular on mental health. But there is some literature, but it's not very much.
Okay, so a reason to continue to stay tuned and see
Absolutely.
what comes out as this
Yeah, for
conversation
sure.
continues. So we're getting to the end. So a couple of questions are left here. So a different maybe cycle that you touch on slightly around the return to work. So can you
Yes.
maybe speak to avoiding the maybe negative cycle of someone needing to leave work, then they come back, and then the burnout happens again, then they're leaving work, and just how do we kind of mitigate for that, and that the return to work is sustainable and successful?
Yeah, I think, we look at those 7 principles of return to work. They might be very helpful to us to have. And, work avoidance is something that we want to stay clear from and not go in that direction. And it's entirely reasonable for someone to think, I don't want to get hurt again at work. I don't want to experience burnout again at work. So I think it requires a concerted effort, as you, as the provider, if you're the disability management professional or the human resources, recognize what your strengths are. And if it's something outside of your quote unquote scope, make sure that you connect them to somebody who can help them out. If it's receiving mental health services, then do that. If it's supporting them from the employer side, so the employer understands what the needs of the person are. If they look fine, maybe on the surface they don't have a fractured knee or leg, and they go, oh, why aren't they going back to work? But having those conversations can go a long way.
Okay, great. Thank you so much for that. And perhaps where we'll end off today is talking about that the culture that you talked about of having these open discussions and having the psychological safety, all of those good things. So, in terms of that, like, what would you say for those to help advocate and kind of lead that change in having this open dialogue, this safe space to say, hey, I need support, I need help, because I think stigma is still something that plays
It's
a
huge.
role here. So if you maybe could kind of end on that note, and then we'll be at time.
Absolutely. I'll try to do this efficiently too. No, I think, all of us have a role to play. I think as healthcare providers, we're actually quite good at compared to some of the other sectors that we're studying, in terms of recognizing health issues. But I think we all have to work together on this. And from the employer side, model that behavior. And sometimes, it's as simple as just checking in with people. How you're doing. How was your day, and nipping things in the bud. Prevention is very, very important. I haven't talked too much about it today, but it should be at the cornerstone of all the work that we do. So for healthcare organizations, if people can do those quick check-ins, how you doing? How was your day? If something, and you can pick things up quickly and build from there. And I think some of the other strategies that we've talked about can definitely work in expanding and amplifying these types of approaches.
Yeah, absolutely. And I think you said something, just even taking your own breath and allowing that space
Yeah,
for, okay, if you need that 2 minutes, take the 2 minutes and come out, and just allowing spaces for people to breathe and share and have those human connections at the end of the day,
absolutely.
right? Yeah, absolutely. Well, thank you again so much for having such a rich discussion at the end. I'm so glad to see the participation from the audience and yourself, and these great discussions, and kind of going all over the map in terms of what this very fulsome topic can do.
Continue to learn and connect with the Work Wellness Institute and see how we're transforming research into workplace performance and health at www.workwellnessinstitute.org.